My name is Dr. Meghan Moody, and I'm a licensed clinical psychologist. I'm the Associate Director at the Family Resource Counseling Center in West Los Angeles, and I have a private practice in Calabasas. Child and adolescent psychology is my main focus. It's an area that I've had specialized training in. However, I do have a broad practice. I would say one of the other areas that I love, and that's a focus of mine, is working with men who are struggling with depression and maybe issues of grief. And that's an area that I'm very passionate about. When adults come into my office and they see my play therapy supplies and they see my art supplies, I get different reactions. Some people walk in the door and they don't notice anything. They, are more concerned about whether they're going to sit on this couch or that chair or where I'm sitting or they're sitting. And then I have other people who are very sort of preoccupied with what's behind the couch and are curious about it. And so when that happens, I usually make some kind of observation and ask them what they're curious about. So I have different experiences from people. I let adults do whatever they want in therapy, so if they want to talk, that's great. If they want to play, that's great too. That doesn't really happen very often, but there have been times when I've been working with an adult and there's been a crisis, and let's say it's some kind of traumatic event that's happened in somebody's life, or they've become very, very depressed and talking is difficult. And I've actually had adults that I've worked with where we'll do some drawing or some art, or we'll play some kind of game that's using less words that helps them access their feelings and get a feeling of support during that time. So that happens sometimes. When I first meet with the parents, which I do before I see the children usually, I try to help them understand that my role is not to take over as parent, but to help them look at how they've been parenting from a different perspective, to be willing to try new things that they might not have tried before. And I often invite them in to observe my therapy session with the child so that they can kind of sit by and they can watch, or they can join in and interact with us, and that way get a sense of feeling safe. I always let them know that the beginning of the work is a time for them to get comfortable with me as their child's therapist, because it's really a lesson in letting go and trusting that, can somebody else help my child? And I'm kind of giving that up to this other person. So I really want parents to be involved in that process with me and feel safe in the decision that they're making. My life as a parent has completely influenced my work as a child psychologist. I think that I've learned to sometimes realize that I don't know anything, and then other times realize that everything that I know is so important, because every moment the child is learning from me. And as a mother, that's something that I experience every day. And bringing that to my work and realizing that every interaction, every moment that I have with this child is an experience for them to learn. And being a mom has taught me that.